Urogynecology? What are you talking about? Urology? Gynecology? Obstetrics and gynecology? Oh, and this other thing called female pelvic medicine. Hi guys, it's Dr. T and I'm back again. All right, so today I'm going to talk to you a little about urogynecology. And you might be like, urogynecology? What are you talking about? Urology? Gynecology? Obstetrics and gynecology? Oh, and this other thing called female pelvic medicine and reconstructive surgery. What's all this about? Who needs a urogynecologist? Why the names? And also, what do we do? So let's just start with the basics and let's talk. Before I get into all of that, I just wanted to introduce a little name I'm thinking up for myself, or at least a name that I've thought up for myself, Dr. Pelvic Floor. So whenever I talk about things medicine-like, I think I'm going to introduce myself as, hi guys, it's Dr. Pelvic Floor. Let's get going and let's talk. Still, of course, this channel is an evolution, but you've really got to tell me what you think. I think it's pretty cool, and I love that name, Dr. Pelvic Floor. That said, let's get into it. What's this urogynecology business? What's a urogynecologist? What's a female pelvic medicine and reconstructive surgeon? So if you can imagine, a urogynecologist is a type of physician, a doctor essentially, who takes care of women. So hence urogynecologist. The gynecology portion of urogynecologist implies taking care of women. Now, how does one become a urogynecologist? Let's start there. Let's just start to begin with. So in different countries, there's different pathways to becoming a urogynecologist. But the route that I took was through the United States. So what did I do? So first and foremost, in a prior video, I let you guys know that I did my undergraduate degree at Queen's University in Kingston, Ontario. It was fantastic. It was fabulous. I learned so much. I mean, I'm not saying that it was easy or anything like that, but I really had a good time in undergrad. I was able to take the prerequisite courses that required me to enter medical school. So prerequisite courses are those courses that are deemed to be important to form a basis for an individual who wants to actually go into medical school. The school wants to know that this person can do scientific work and also understand scientific work and also can process scientific knowledge and information in such a way where if they do relatively well, that they actually will be a good candidate for medical school. So I actually got into medical school in the United States at Wake Forest University, and definitely I said that in a prior video. Wake Forest was fantastic. I had a fantastic time in medical school. Medical school in the United States is typically about 4 years. So I did 4 years. And what does doing 4 years of medical school mean? So for us at the time, my first 2 years were those core years where you were in the classroom and you were learning about the different systems of the body and also some of the theory and a lot of that book-based teaching. And then it was actually in my third and fourth years where I actually was doing patient-based care and beginning to understand as I rotated through the different rotations, emergency medicine, obstetrics and gynecology, general surgery, etc., what was the best fit for me? Ultimately, it was in my third year of medical school where I was first introduced into the concept of urogynecology. Now, what actually happened was there was a plastic surgeon that came to our medical school. And what did that plastic surgeon do? So that plastic surgeon actually came and during an anatomy lab, if I can remember correctly, it was actually during an anatomy lab that we were able to see some of the issues that he had had with the pelvic floor and this idea about there is a group of urologists, gynecologists that do something called urogynecology, also known as female pelvic medicine and reconstructive surgery, about really organizing and reorganizing the pelvic floor in order to get it as much back to a steady state or an acceptable state for the woman as possible based on the evidence that is out there. Now, I thought that was the absolute coolest thing. It actually blew my mind. I was like, what is that? and how can I become that? And that is what I'm going to do. Now, I was one of those people that loved all the rotations in medical school. And when I finally got that feeling, I was like, yes, I feel like I have a purpose and I feel like I can actually try to become a urogynecologist. So it was relatively early for me in medical school. That was in my third year. So then I thought to myself, okay, I'm really interested in obstetrics and gynecology. I've heard about urology. I think it's cool. I knew that based on speaking to my teachers and also to other surgeons, that really to become a urogynecologist, you'd have to do either urology or obstetrics and gynecology. So then overall, when I was thinking and contemplating as to what type of physician I wanted to be, I chose the obstetrics and gynecology route. So obstetrics and gynecology in the United States is 4 years. And so once you finish those 4 years, you become an obstetrician and gynecologist. However, subsequently, if you want to become a urogynecologist, you would have to complete an additional 3-year fellowship, specifically in urogynecology or female pelvic medicine and reconstructive surgery. So that didn't faze me at all. I said to myself, yes, I'm absolutely going to do what it takes in order to do urogynecology. Once I finished my 4 years of training in obstetrics and gynecology residency, I was able to match right away into a program in the same city that I was already in. So I didn't have to move much. Now, that literally means you finish June 30th and you start your new program July 1st because you're straight into it and you go right away. My fellowship was fantastic. I trained with the best people, the best urogynecologists in the world, and I felt that I got the depth and breadth of the pelvic floor and understanding truly the essence of urogynecology and what it is. So that leads me into what is a urogynecologist and what we do. So I already told you that we did training in obstetrics and gynecology. I certainly could have done training in urology and then subsequently went into a fellowship in urogynecology, but I chose the obstetrics and gynecology route. Generally, when you do obstetrics and gynecology training, you do training in obstetrics and delivering babies and all of the maternal and antenatal care and even some postnatal care of the woman and baby. And then the gynecology part is gynecology and treatment of female pelvic organs and the associated diseases that can come with them. Now, it's a whole different thing. If you guys want me to talk about gynecology and obstetrics in the future, I certainly can, but right now I just want to focus on urogynecology. So if you can imagine the impact of obstetrics and the delivery of a child, the delivery of a baby, and what it can do to the actual pelvic floor. Let me show you my pelvic floor again. This is the pelvic floor. And again, we're definitely going to go over this shortly, but I just needed to give you a basis as to why would I be talking about this in the beginning. So when we think about the basis, the effects of obstetrics and how that can impact the pelvic floor, and then how a urogynecologist might be important later, then you can actually see how these things are connected. So I had the discrete privilege of actually seeing the labor and delivery process, seeing what can happen to the pelvic floor and the changes in the pelvic floor, plus taking care of gynecologic women all through the ages. This was teens all the way through adults and older adults, whether it was routine gynecological care, office-based gynecological care, surgical gynecological care, whatever the combo it was, or whatever specifically it was. In my training, I was exposed to different cohorts of women along the ages. It was the coolest thing, like I said. But let me come back to, again, urogynecology. If you understand the effects of obstetrics on the pelvic floor, and then also understand the gynecologic structures of the pelvic floor. And then if you also incorporate urologic teachings and ideals, especially with the kidneys, the ureter, the bladder, the urethra, etc., in combination, overall, I would say that makes urogynecology. However, classically, if you want to think simply, imagine aspects of gynecology and aspects of urology put together, concentrating on the pelvic floor, for example, of a woman, and then that's how you get urogynecology. But not forgetting the principles of the effects of obstetrics and also other branches of medicine, because holistically, you take a look at the whole woman. It's not like I'm only focusing on the bladder. I'm actually taking a look at the whole woman and how it can relate to her pelvic floor. You can see here that there's bony structures as well. So it's important to really understand the effect of the hips, the knees, the muscular structures, the ligaments, the tendons, etc., that can also play a role in how the pelvic floor can behave. That essentially is what a urogynecologist is. So in my next video, I'm actually going to go through step by step the different conditions that a urogynecologist will actually take care of. And those conditions range within a wide variety of different diagnoses and pathology and disease processes. In addition to that, there are a lot of diagnostic tools that we as urogynecologists use. And then finally, there's a lot of treatment, whether conservative or surgical, that we actually use in treatment of the pelvic floor. But that's going to be another video. I didn't want to overwhelm at all in this video, and just to try to get a concept about what I do and what urogynecology is and why I would be interested in the future talking about the pelvic floor. In summary, I just wanted to state again that a urogynecologist is someone who understands those three facets of medicine. The three facets would be gynecology, urology, as well as obstetrics, but also understanding general medicine and how it can apply to the body, plus also understanding the mechanics of the body in general. A urogynecologist works in the clinic and also works in the operating room. I hope you can't see any operating room lines. I've been in the operating room all day today, so I hope you're not seeing any of those lines. And if you see any lines, that's totally okay with me. Now, some of you might be like, wait a second, but I've heard about research and I've heard about other things that physicians do. And certainly that has to do, when talking about research, that has to do with what type of center you're working at. And that certainly can be for another video where I talk about where research can fit in being a clinician and also a surgeon. I also talk about the different types of hospital setting and environments that can allow for research or are very conducive to research, because it definitely is an important part of many physicians' practices, many urogynecologists' practices. So why female pelvic medicine and reconstructive surgery? So I think I just gave you a little bit of an introduction to that, which means essentially that there's a clinical component and there's an also surgical component. We are taking care of women, female, pelvic medicine, just like we had discussed about the pelvic floor and about the influences onto the pelvic floor. And then medicine, which is the clinical component. You have to understand the individual's body. You have to understand aspects of internal medicine, family medicine, general practice, as how it applies to the human body. And you also have to work within the clinic for routine issues and also complex issues that are non-surgical. And then you have the reconstructive surgeries. So the reconstructive surgeries that often us urogynecologists are reconstructing the pelvic floor in order for a woman to regain some, if not all, of her function that she had prior to experiencing the pelvic floor event. And again, I'll discuss pelvic floor events in another video. So that is the reconstructive surgery part. And so that's why we as urogynecologists are also known as female pelvic medicine and reconstructive surgeons. So definitely I understand that it can be a little bit confusing, but we're one and the same. And ultimately I've described to you my training, which was obstetrics and gynecology, and then subsequently a urogynecology fellowship. Now the fellowship is 3 years, so I've trained for a total of 7 years after medical school alone to become a urogynecologist. If other individuals, for example, come from the urology side, urology programs are about 5 to 6 years, depending on where you go. And then these urologists will then subsequently also have to do fellowships. And those fellowships sometimes are 1, 2, or 3 years added on top of the 5 or 6 years that the urologist would have done. So at the end of the day, that makes up the pool of urogynecologists. So overall, I hope that makes sense, and I hope that starts as an introduction as to what urogynecologists are, what it took, for example, for me to become a urogynecologist and some of the training I went through. And if I certainly have piqued anyone's interest and there's questions, just type them in the comments below and I'll be able to answer them. Hopefully you guys can get better knowledge as to what we do. I think my job is the coolest job in the world, and one of the best decisions I ever made was to become a urogynecologist. So anyways, guys, I've introduced you to Dr. Pelvic Floor when we're talking about the pelvic floor. I think I'm going to keep that up. I'm not 100% sure yet how I'm going to organize it within the context and within text, but you know, again, this is a work in process and I have you guys to bounce things off of. In conclusion, I hope you guys have a great day, and this is Dr. T as Dr. Pelvic Floor representing. All right, bye guys. See you next week.